Skin disorders, pictures, causes, symptoms, and treatment. Skin disorders vary in symptoms and severity, some can be life-threatening. Situational and genetic causes of skin disorders exist. Acne includes redness, blackheads, whiteheads, pimples, and cysts. Cold sores are red, painful blisters near the mouth and lips. Blisters are watery, fluid-filled areas on the skin. Hives are itchy, raised welts caused by allergen exposure. Actinic keratosis is a scaly skin patch caused by sun exposure. Rosacea causes facial flushing, red bumps, and skin dryness. Consult a doctor if you suspect a skin problem. Skin disorders are a broad category of medical conditions that affect the skin's appearance, texture, or functioning. These conditions can range from mild and temporary to severe and chronic. Here are some common skin disorders. 1. Acne. Acne is a common skin condition characterized by the formation of pimples, blackheads, whiteheads, and often pustules. It is most common during adolescence but can affect people of all ages. 2. Eczema. Dermatitis. Eczema is a chronic condition that causes the skin to become red, itchy, and inflamed. There are various types of eczema, including atopic dermatitis, contact dermatitis, and seborrheic dermatitis. 3. Psoriasis. Psoriasis is an autoimmune disease that leads to the rapid buildup of skin cells, resulting in dry, red patches covered with silver-colored scales. It can cause itching and discomfort. 4. Rosacea. Rosacea is a chronic skin condition that primarily affects the face, causing redness, visible blood vessels, and sometimes small, red, pus-filled bumps. 5. Dermatitis herpetiformis. This is a chronic blistering skin condition linked to celiac disease. It presents as itchy, red bumps and blisters, typically on the elbows, knees, and buttocks. 6. Urticaria. Hives. Urticaria is characterized by raised, itchy welts on the skin that can appear suddenly. It is often caused by allergies but can have various triggers. 7. Vitiligo. Vitiligo is a condition in which the skin loses pigmentation, leading to white patches or streaks on the skin. It occurs when melanocytes, the cells responsible for skin color, are destroyed. 8. Fungal infections. Conditions like ringworm, athlete's foot, and jock itch are caused by various types of fungi. They lead to redness, itching, and sometimes peeling of the affected skin. 9. Herpes simplex. Herpes simplex is a viral infection that causes cold sores or fever blisters around the mouth and genital herpes in the genital area. 10. Impetigo. Impetigo is a highly contagious bacterial skin infection that leads to red sores and blisters, often around the nose and mouth. 11. Skin cancer. Skin cancer includes various types, with the most common being basal cell carcinoma, squamous cell carcinoma, and melanoma. It is characterized by the abnormal growth of skin cells. 12. Seborrheic keratosis. Seborrheic keratoses are non-cancerous skin tumors that can appear as brown, black, or pale growths with a waxy or scaly surface. 13. Keratosis pilaris. This is a common, harmless skin condition that causes small, hard bumps to form on the skin, often on the upper arms, thighs, face, or buttocks. 14. Cellulitis. Cellulitis is a bacterial skin infection that can cause redness, swelling, warmth, and pain in the affected area. 15. Hidradenitis suppurativa. Hidradenitis suppurativa is a chronic skin condition that leads to the formation of painful lumps or abscesses in the armpits, groin, buttocks, and under the breasts. It's essential to consult a healthcare professional for an accurate diagnosis and appropriate treatment for any skin disorder, as treatments can vary widely depending on the condition and its severity. Treatment. Common skin disorders. The treatment for common skin disorders depends on the specific condition and its severity. Here are some common treatments for various skin disorders. 1. Acne. Over-the-counter, OTC, topical treatments with ingredients like benzoyl peroxide, salicylic acid, or sulfur. Asterisk. Prescription topical or oral antibiotics. Asterisk. Topical or oral retinoids. Asterisk. Light and laser therapy for severe cases. 2. Eczema, dermatitis, emollient creams or ointments to keep the skin hydrated. Antihistamines for itching. Phototherapy, UV light, in some cases. 3. Psoriasis, phototherapy. Systemic medications, oral or injectable, for severe cases. 4. Rosacea, oral antibiotics for inflammatory rosacea, laser therapy for visible blood vessels. 5. Vitiligo, a narrowband ultraviolet B, NBUVB, phototherapy. Surgical procedures like skin grafting or melanocyte transplantation in severe cases. 6. Fungal infections, antifungal creams, powders, or sprays, oral antifungal medications for severe or systemic infections. 7. Herpes simplex antiviral medications to reduce the severity and duration of outbreaks. 8. Impetigo antibiotic creams or ointments, oral antibiotics for severe cases. 9. Skin cancer or surgical removal of the cancerous tissue. Radiation, chemotherapy, or immunotherapy therapy. 10. Seborrheic keratosis, usually no treatment is needed, but they can be removed for cosmetic reasons. Removal methods include cryotherapy, electrosurgery, or laser therapy. 11. Keratosis pilaris, moisturizing creams with lactic acid, glycolic acid, or urea, topical retinoid. 13. Cellulitis antibiotics, typically prescribed orally. Antibiotics, pain relievers if there is discomfort or fever. 14. Hidradenitis suppurativa injections of corticosteroids or biologics surgical drainage or removal of abscesses in severe cases. It's crucial to consult a healthcare professional for a proper diagnosis and treatment plan tailored to your specific skin disorder. Self-diagnosis and self-treatment can sometimes worsen the condition or cause side effects. Precaution for common skin disorders. Preventing common skin disorders often involves good skincare practices, lifestyle choices, and awareness of potential risk factors. Here are some precautions and preventive measures for common skin disorders. 1. Sun protection *, use sunscreen with broad spectrum protection *, seek shade during peak sun hours *. 2. Hygiene and handwashing *, maintain good personal hygiene to reduce the risk of skin infections *, wash your hands regularly and thoroughly with soap and water. 3. Skincare *, use mild, fragrance-free cleansers and moisturizers to avoid skin irritation *, pat your skin dry after bathing, avoid vigorous rubbing. 4. Healthy diet *, consume a balanced diet rich in fruits, vegetables, and lean proteins *, stay hydrated by drinking plenty of water to keep your skin moisturized. 5. Stress management *, high stress levels can trigger or worsen certain skin conditions like eczema or psoriasis *, practice stress reduction techniques, such as meditation, yoga, or deep breathing exercises. 6. Allergen avoidance, identify and avoid allergens or irritants that exacerbate skin conditions like eczema or contact dermatitis. This may include certain foods, fabrics, or cosmetics. 7. Appropriate clothing, wear breathable fabrics and avoid tight-fitting clothing, especially in areas prone to chafing or sweating. Change out of wet or sweaty clothing promptly to prevent skin irritation. 8. Acne prevention, use non-comedogenic skincare products. Avoid picking, squeezing, or scrubbing acne lesions, as this can worsen scarring. 9. Infection control, practice good wound care to prevent skin infections. Keep cuts and scrapes clean and covered. Avoid contact with infected individuals if you have open sores or wounds. 10. Regular skin checks, perform regular self-exams for unusual moles or skin changes. If you notice anything suspicious, consult a dermatologist. 11. Proper dermatological care, if you have a family history of skin conditions, consult a dermatologist for early assessment and guidance on preventive measures. 12. Vaccination, consider vaccines that can prevent certain skin conditions, vaccine to reduce the risk of genital warts and certain types of skin cancer. 13. Avoid excessive scratching. Excessive scratching can worsen many skin conditions. Trim your nails short, wear gloves at night, or use anti-itch creams to reduce the urge to scratch. Remember that preventive measures and precautions may vary depending on the specific skin disorder and individual factors. Consulting with a dermatologist can provide personalized guidance for your skincare needs. Conclusion. In conclusion, common skin disorders are prevalent conditions that affect people of all ages and backgrounds. These disorders can vary in severity and symptoms but often have effective treatments and preventive measures. It's essential to be aware of these disorders, their causes, and the precautions and treatments available. Regular skincare, good hygiene, sun protection, and a healthy lifestyle can go a long way in preventing many skin disorders. If you suspect a skin problem or experience persistent symptoms, consulting a dermatologist is crucial to receive an accurate diagnosis and tailored treatment plan. Early intervention and proper care can help manage and, in many cases, alleviate the discomfort and impact of common skin disorders, promoting overall skin health and well-being. Medical information disclaimer. This video contains general medical information. The information in this video is only for educational purposes. The medical information is not advice and should not be treated as such. You must not rely on the information in our videos as an alternative to medical advice from your doctor or other professional healthcare provider. My channel Health Tips by Shah Ji provides valuable information on how to stay healthy and fit. You can learn about the latest health trends and tips to help you stay healthy. Health Tips by Shah Ji is the perfect resource for anyone looking to improve their overall health and well-being.